Hi, I'm Dr. Diana Kersten. A lot of people have difficulty taking eye drops. There's a right and a wrong way to do it. This video will teach you the right way to take eye drops and give you some tips for people who have a hard time with taking your drops. First, when should you take your eye drops? If you're supposed to take more than one type of drop at the same time, then separate them for about 5 minutes. This lets the first drop be absorbed by the eye before it gets washed out by the second eye drop. Most eye drops come in bottles that have a screw-on cap. Once you unscrew the cap, you need to be careful not to touch anything to either the inside of the cap or the tip of the bottle because these areas are sterile. Any bacteria that gets on those surfaces can grow in the bottle and contaminate the eye drops. Some eye drops come in little vials like this, where you twist off the cap. These are usually drops that have no preservatives, and they're designed for you to take as a single eye drop and then throw the entire vial away. Without preservatives, there's nothing to keep bacteria and fungi from growing inside the bottle, so the manufacturers make them a single-use vial. Throwing the vial away is what's recommended and approved by the FDA, but to save money, some people like to use these droppers more than once. If you're going to do that, here's what I recommend. Keep the tip of the vial from touching anything and store the vial with the tip up inside a clean shot glass or another narrow container. Keeping this in the refrigerator will also minimize but not entirely prevent contamination. Okay, here's how to take eye drops. First, tilt your head back as far as possible. Sometimes laying down makes this easier. If you're right-handed, hold the eye drops in your right hand. Use your left hand to pull down your lower eyelid, which makes a pocket between your lower eyelid and your eyeball. This is where you're aiming for the drop to fall. Rest your right wrist on the knuckles of your left hand. This gives your right hand better control and stability. Between the thumb and index finger of the right hand, hold the bottle an inch or more above the pocket of the lower eyelid. Don't let the dropper tip touch your skin, the eyeball, or the inside of the eyelid. Squeeze out one drop and let it fall into the pocket. You can do the same maneuver for either eye. Putting the drop on the forehead or cheek doesn't count, but this may happen when you're new to putting in eye drops. If you miss, just try again and you'll find that you can get pretty good at getting the eye drops in your eye. If you absolutely can't do this, there's another way that's not quite as good, but almost anyone can do it. Look up towards the ceiling or lay flat if you prefer, and keep your eye gently closed. Let the drop fall in the little valley around the inside corner of your closed eyelids. Then open your eye and blink a few times. The drop will roll into the eye. This method is not quite as good because the drop comes in contact with your skin before going into the eye, giving an opportunity for the skin bacteria to contaminate the eye drop. Though it's not ideal, this method is usually better than not taking your eye drops at all. By the way, there's never a reason to take more than a single drop of any medicine. The eyes don't hold any more than one drop, so taking more than one drop is just wasting medication. Some people say they can't always feel when the drop goes in the eye. A good way to make this easier is to refrigerate your eye drops. You'll feel the cold on your eye. It's actually kind of soothing, and although it's not required to refrigerate most eye drops, it won't do any harm to keep them refrigerated. If you take drops that are stingy or irritating to the eye, it often helps reduce the stinging quite a lot to keep the drops in the refrigerator. I hope you find this information makes taking your eye drops easier. I'm Dr. Diana Kersten. Thanks so much for watching.